Medications. Part 1, medications that affect sleep. There are many medications that one could be taking that could actually affect their sleep. Here is a list and we'll go through each one individually. Alpha blockers, beta blockers, antidepressants and antipsychotics, steroids, ACE inhibitors, blood pressure medications, statins, stimulants, hypnotics and sedatives, narcotics, other miscellaneous medications, and supplements. Alpha blockers are medications that are used for hypertension and are also used for people who have an enlarged prostate. This medication decreases REM sleep. This is an issue because we process emotions and memories during this time of sleep. Beta blockers are typically used for blood pressure and arrhythmias. They may also be used for migraines, angina, tremors, and glaucoma. The side effects include disrupted sleep and nightmares. This may be associated with low levels of melatonin. MAOIs completely eliminate REM and can decrease total sleep time. Tricyclic antidepressants decrease REM sleep and increase slow wave sleep. However, depending on the medication, it can either be a depressant increasing sleep or activating where it will decrease sleep. SSRIs will decrease REM, and when they come off, will increase REM sleep. Antipsychotics improve sleep, however, they can either increase or decrease slow wave sleep depending on the dosage. They are sedating, so daytime sleepiness can be an issue. Mood stablers and anti-epileptics, lithium can cause sleepiness and total sleep time. It can increase slow wave sleep and decrease REM. It also can cause sleep movements, such as sleep talking and sleepwalking. Depakote has increase in sleepiness, but no change in sleep architecture, and Tegatrol can cause restlessness and insomnia. Steroids use the adrenal gland to help produce anti-inflammatory responses in the body. This can actually cause adrenal fatigue and increase in cortisol levels, which can lead to insomnia. ACE inhibitors are used for hypertension, congestive heart failure, and high blood pressure. The side effects of ACE inhibitors include dry, hacking cough, and increased potassium levels that can cause joint pain and leg cramps. Unfortunately, the only solution for this is to change medications. ARBs are another medication for heart failure, but specifically in patients with diabetes or kidney disease. This also has issues with increased potassium that can cause achy joints and leg cramps. Statins are used to treat high cholesterol. They can cause breakdown of muscle tissue, which causes pain and weakness. This can also lead to insomnia. Certain fat-soluble statins can cross the blood-brain barrier and cause nightmares. Stimulants, including caffeine, nicotine, illegal drugs, and prescribed stimulants such as Provigil, Ritalin, and other medications to treat ADHD. The half-life of these drugs can cause significant issues with insomnia, waking after sleep onset, and decreased slow-wave sleep and increased REM sleep. The effect can be impaired memory, depression, and daytime fatigue. Hypnotics and sedatives increase total sleep time and stage 2 sleep. It also increases sleep spindles, which is a specific type of brainwave, but the effects of this change are unknown. It will also increase daytime sleepiness the next day. They decrease sleep onset, wake after sleep onset. One thing you must consider when weaning off of hypnotics is rebound. This can last as long as 1 day to 2 weeks, depending on what is taken and for how long. It will be a return of symptoms that started the person to taking the medications. Although narcotics are used acutely, there are more and more people who are using them for pain management. This will cause an increase in fatigue and sleepiness, and it will cause a decrease in REM sleep, which can cause issues with memory. Some over-the-counter medications can also affect sleep, including aspirin, which can cause a decrease in slow-wave sleep. Tagamet increases slow-wave sleep. Marijuana, when used long-term, will decrease slow-wave sleep. And antihistamines will decrease REM sleep and can cause daytime fatigue and insomnia rebound. Supplements such as valerian, chamomile, and GABA have no scientific support that says they help with sleep. Melatonin is a sleep supplement that is a natural occurring substance in the body. It is secreted in the hippocampus to initiate sleep onset. The problem develops when we take this supplement, we stop our body from producing its own melatonin. The other issue is dosage. Most research has shown that very small doses of less than 1 milligram is sufficient. However, it does need to be able to get into the bloodstream, so it must be taken properly, such as extended release capsules that do not dissolve in the stomach, sublingual or quick dissolve that are absorbed prior to entering the stomach. You are now ready for the next module.